Hello.
Hello.
Can I have your GMC number, please?
Yes, please.
Okay, have you understood your task?
Yes, please.
Okay, please proceed.
Thank you very much. So in real life, I would greet the patient, introduce myself and check the identity. I would explain that I'm here to examine his back passage with the help of one gloved laboratory finger. I will take the consent of the patient before I proceed. I'll ask my patient to undress below the waist, for which I'll provide adequate privacy, and I'll ask for a chaperone. I would then ask my patient to lie on his left side with the thighs and the knees bent as close as possible to the chest and the buttocks at the edge of the cup. I warn my patient I'm about to start my examination. May I ask for lubricating gel, please?
Doctor, it's lubricated already.
Thank you very much. So on inspection of my patient, I can appreciate that there is not any discharge, no any redness, no swellings, no scars, no any sinuses. I can appreciate there is an anal fissure on the posterior aspect of the anus. There is not any external hemorrhoids. I would ask the patients to strain to check for any rectal prolapse. I warn my patient I'm going to insert my finger. I'll place the palm of my finger on the anal sphincter. I will press firmly and gently, and I'll wait for a few seconds for the sphincter to relax. Slowly, I'll try to introduce my finger. At this stage, I'll check for the comfort of my patient. If he finds the procedure very painful, I will stop the procedure. Inside, there is no fecal impaction. I will once again ask the patient to strain to check for rectal prolapse. The right lateral wall is free. I cannot palpate any abnormalities. The posterior wall is also free. I cannot palpate any abnormalities. The left lateral wall, I can feel there is a mass which is about 1 centimeter in diameter. It's attached to the left lateral wall. It's not mobile. I would ask my patient for any tenderness. Through the anterior wall, I can palpate the prostate. I can appreciate the two lobes. The right lobe is slightly enlarged in size. The surface is irregular and it is hard in consistency. The right lobe is normal in size. The surface is smooth and is firm in consistency. The median sulcus is normal. The anterior mucosa is also mobile. I would ask my patient for any tenderness. I warn my patient I'll be removing my finger. Before that, I'll ask him to squeeze my finger to check for the anal tone. There is not any bleeding or discharge. I would thank my patient for the cooperation and ask him to dress up.
What is your diagnosis, doctor?
So from my examination, my most proper diagnosis is a unilateral prostatic cancer, and I also could appreciate there is a mass on the left lateral wall of the rectum of my patient. I would consult my seniors to confirm my findings.
Okay.
To complete my examination, I would also perform the urine dipstick. I would perform further blood tests like FBC, U1Es, LFTs, glucose, and clotting in my patient. I would also discuss with my seniors and perform a prostate-specific antigen. And if any of this is positive, then I would consider performing a transrectal ultrasound scan and a biopsy in my patient. Thank you very much.